Seeing none, we'll move into information items, and I'll turn it over to Mary Ann.
Thank you very much. So this is an information item on Bill 148, the Fair Workplaces, Better Jobs Act 2017. If you recall, at the last HR committee meeting, I also presented the preliminary information on this new proposed act and indicated that I would bring back the financials associated with that. Also, you'll see in addition to the original report that had the Association of Municipalities of Ontario, AMO, submission, we've also included the Ontario Municipal Human Resources Association, OMRA, submission as well. So the background, as we know from the last time on the ESA, what's happened. And so here, just to point out for your interest, as per the AMO website, that this bill has the policy intent to reduce precarious employment. However, if not amended appropriately, it will greatly affect municipal operations, even though municipal employment is not precarious. Improving worker entitlements must balance with being able to provide all the legislated municipal obligations. It should not reduce the ability of local governments to provide critical daily and emergency services to our communities. As per the submission from OMRA, in conclusion, OMRA submits that Bill 148 consists of significant changes to the ESA and LRA that will have many unintended consequences on municipalities. These unintended consequences, as outlined above in their report, could have dire financial costs on municipalities, such that Bill 148, as it is currently drafted, could significantly affect the level and quality of services municipalities are able to provide their residents. So under the financial, staffing, legal, IT considerations, a preliminary costing exercise was undertaken to determine potential budgetary impacts related to the proposed changes set out in Bill 148. To provide realistic cost impacts, there were assumptions undertaken, including, I'll just move to that page, including the updating of management processes to address such matters as scheduling and advance notice. 5 areas of the proposed legislation were identified to have potential substantive financial impact based on our current operations, collective agreements, and human resources policies. The most notable change is the address of the proposed legislation, the right to refuse work. By proposing utilization of minimal department coverage and primarily 24/7 operations through utilization of on-calls to address potential work shortages, we did come up with the following costing. So we see an impact for our students of $13,600, equal pay for full-time and part-time, $39,124, primarily associated with highways and long-term care. On-call costing, subject to increase, is over $1 million, and paid emergency leave, 2 paid days per employee, 306, and public holiday pay of approximately $7,400, for a potential total cost of $1.439346 million. And I will note that is based on giving coverage, because we have to give 4 days notice to have somebody come to work. That's based on giving very minimal coverage. If that minimal calling type coverage that we're proposing here doesn't work, this could be substantially higher. For instance, if we had to actually have an extra ambulance on site for 3 shifts 24/7, then that's substantive cost. Right now, this costing is framed such that we would have people on call and being called for on call, but if they can't get in to get the ambulance working and we have to go to actually manning additional roles, then we're going to have a much higher associated cost. So there is a recommendation that the following submission be supported in principle, and that the Human Resources Committee authorize the CAO or warden to sign a letter of support of these 2 submissions.
You've heard the recommendation. Could I have a mover and a seconder? Moved by Ann, seconded by Mike. Further discussion or any discussion? Mike?
Just a comment. I think this is probably, well, 1.4, it's at over 3%. That would be a 4% increase built into without any other, very close to 4%. I think we all agree that some of the objectives, but this would be a very expensive undertaking for all of us. And it'll be the same impacts at our lower tiers.
Yes, huge, huge impact. Any other comments? You've heard the recommendation. It's been moved and seconded. All those in favor? Opposed? Motion is carried.
Okay, so we're on to the adoption of revised health and safety policies. I'll just scooch down here. So in June 2016, the county senior management team, the SMT, established the review and revision of the county's health and safety manual as a priority. Both the health and safety policy and the workplace violence prevention policy were revised. On August 1, 2017, SMT directed that these revised policies should go forward to council with a recommendation for adoption. The Ontario Occupational Health and Safety Act requires employers to establish policies on health and safety as well as workplace violence prevention. The Act also requires annual review of these policies and revision. The latest review and revision of these policies compiled in this requirement. So if this is adopted, we'll have we'll have review dates established, and if there's any more detail that's required, John Van Delden is here with us this morning, our health and safety manager, and he has driven this project forward. So there is a recommendation that council adopt 2 revised county health and safety policies, specifically health and safety and workplace violence prevention.
Thank you. You've heard the recommendation. I have a mover and a seconder. Milt and Ann, discussion. All those in favor? Opposed? Motion is carried. That's it. Right? Yeah. Next meeting scheduled for September the 7th, and I need a motion to adjourn. Mike and Ann, all in favor?